Despite increased attention and awareness about mental health in recent years, especially the needs of veterans, the number of veteran suicides in New York spiked in 2023, the most recent year with federal data available. The number reached the highest level in 2 decades, according to an analysis by the New York Health Foundation. For more on this alarming data and how state policymakers should respond, we're joined by Derek Coy, who served as a Marine in Iraq and is the Senior Program Officer focusing on veterans' health for the New York Health Foundation. Thanks for making the time, Derek.
Thanks for having me back. It's always good to be with you.
So while New York's overall suicide rate has remained relatively constant for the last decade of federal data, just under 11 suicides per 100,000 people each year, the rate of veterans taking their own lives went from about 20 per 100,000 to 25 per 100,000, a 25% uptick, while the rate of veteran suicides remained basically constant nationally, albeit about 10 percentage points higher than the Empire State. Is this jump a head scratcher for you, potentially an outlier, or is there something that was happening around 2023 that would have contributed to a spike and might lead to higher numbers in 2024 and 2025 when we get that data as well?
Yeah, well, I appreciate you covering this topic, and those are all really great questions. We hope it is a spike that is just a blip in time because it's really tragic to know that we're already in the midst of a suicide epidemic, and to see an increase is always incredibly tragic, especially knowing that there are lives associated with these numbers. One thing in particular that is incredibly troubling is, we've talked about this before historically. I think there's an unprecedented amount of attention focused on preventing veteran suicide nationwide, especially in New York State. So you've seen things like the Governor's Challenge, partnership between federal and state entities, private organizations like the New York Health Foundation, and everyone's really been laser focused on this. And I think you have some of the brightest minds, some of the most dedicated people focused on this topic. So to see not only an increase in general, which is disheartening, but to see the spike that we did, to your point, is really a head scratcher. We're really not sure what exactly we can attribute it to. There's a term by a German theorist called wicked problems, and suicide is one of them, where there's not a panacea. There's not one thing that we can say caused or will be a solution to it. So there's a lot of factors, and I think that's what we're doing now, is working backwards to see what was different then, what could we have done, and what do we need to be looking forward, moving forward, working on this topic.
Well, in terms of the rationale for this, is there good data on what might drive veterans to commit suicide? And if there isn't, is there anything that the state could do to get a better handle on what might be driving these trends? Is there a better collection of data, for example, that we should be pursuing?
Yeah, absolutely. So one, I think there's two issues. The first being there's already pretty good data out there. The issue is that we get it very late. So we're discussing suicide rates in New York State from 2023 because we get them from VA, of course, a federal resource. But we're retroactively looking at what happened back then. What would be great is to know when these suicides are happening in real time. In addition to that, what time of day, what time of year, so we could help with outreach. Also looking at counties. We're not sure where these 167 suicides happen throughout the state. So understanding the data, getting it quicker, and having more granular data would be incredibly helpful. And that's something that there's been some legislation introduced. There's been a lot of movement again in the past. Unfortunately, some of the great legislation that's been passed hasn't really been enforced. So we're really trying to see what all we can do to better understand what happened, to get better data, and do preventive outreach to proactively address this topic.
You mentioned the idea of steps being mandated, but maybe not followed up. And one example is a bill from 2021 that was supposed to mandate reporting of veteran suicides from coroners and medical examiners to New York's Department of Veterans Services. And while a report was supposed to be made now almost 2 years ago, we haven't seen that report. What do you think would be the benefit of that type of holistic overview?
Yeah, I think targeted outreach is key, and that's paramount to a lot of the work that we do and folks in the field do. So if we again had real time data, I think we would be more proactive in our approach, and then maybe we wouldn't have to look back 2, 3 years and have this guessing game. What was happening at this time? Again, we don't know if it was at the beginning of the year, at the end of the year, so we could more precisely target what could be happening. And then there's also just been these really large changes, nationally that we've seen and on a state level as well. One that we've discussed, and I can't help but to think on more, is just the prevalence of sports gambling and online gambling that we've seen legalized in New York in 2022. And just by looking at what's been happening with that, we know that sports gambling leads to financial stress and debt spirals. There's family relation disruption, and we know those are all contributing factors to increased suicide risk. So I can't help but to wonder, has that caused any impact on these numbers? And if so, what can we be doing about it? Similarly, I think when we're looking at veteran suicide, we're looking at numbers on the whole. But when we really look at rates more granularly, for instance, you mentioned New York State veterans have a rate of about 25 out of 100,000. But if you look nationally at veterans with cannabis use disorder, the rate is 125. If you look at the veterans with suicide attempts in the past year, the rate is 590. So drastically higher numbers. So the more granular information we can have, especially on the state level, I think the better understanding we'll have about what we can do about this.
Well, you bring up something like sports gambling, which, as you pointed out, had a explosion here in New York with the advent of mobile wagering. But we didn't see an uptick in the general suicide rates for New York. So, is there something about the veteran population that would make them more susceptible to problem gambling than the general population?
Yeah, so that's such a great question. And those are the things that we're trying to extrapolate because when we do look at who is targeted by sports gambling in particular, it's folks that are younger, under 40. And we know that veterans in New York State under 34, so 18 to 34, have by far the highest rates. Those are about 42 per 100,000. And that's why we're continuing to scratch our head. I can't say, and again, it's a wicked problem, so we can't say for sure what has caused any of this, but that's what's so troubling is to try to figure out how we can sparse out this data. How can we see if veterans are protected by some of the factors that they have, or are they being targeted specifically? And right now, we just currently don't know.
Well, I want to come back to the very first question, which was the idea of this being a potential outlier. And because we're talking about a population of about 500,000 here in New York in terms of the military veterans, is it possible that because this is such a small population relative to a state of 20 million, that you might see one-off years where the number might increase, and while it looks like a really big change, 25% in terms of the overall per 100,000 population, when we think about a broader trend like veterans more broadly across the country, you don't see that much of an uptick. So could this just be an aberration based on the size of the population we're talking about?
Yeah, we really hope so. And I think that's where having better and real-time data would, I think, hopefully solve some of these problems. So, for instance, VA is the gold standard for reporting on suicide, but they get all of their information first from counties and then to the state vital statistics, and then that goes to VA. So right now, technically, the data for 2024 and 5 should be accessible. Someone has that information currently, and that's why we and other folks are really looking to see how we can get our hands on that information, so we don't have to look at 23 and hope it's an aberration and it's an outlier, when I think we could actually look at those trends up until last year. And if we had that, I think we wouldn't have to be playing these guessing games. And I think we could invest more in some actionable items as opposed to thinking, what happened 2 years, 3 years ago, which is incredibly frustrating for a lot of folks doing this work.
Well, we've been speaking with Derek Coy. He is a Marine who served in Iraq and is now a senior program officer focusing on veterans health with the New York Health Foundation. Derek, as always, thank you so much for making the time.
Thanks for having me back.
Fraud and lawsuit abuse raise car insurance costs for New Yorkers. Reforms are being proposed to mitigate their impact. But some Albany leaders want to keep the status quo. Information on these reforms is available at keepnewyorkaffordable.org.
Support for the Capitol Press Room is provided by New York State United Teachers, a statewide union of nearly 700,000 professionals in education and healthcare.